Good morning. What's on my mind? I'm Dr. Dale Dangoban, and on behalf of Patient Choice in Chimene F. Point Michelle in Dominica, this is the medical tidbit of the morning. It's 25 degrees out there. Car was covered in ice. It's cold. Anyway, I got my scarf. If you are on a blood thinner, you really need to be aware, right? This tidbit is about Warfarin, Coumadin, same thing, right? It has been replaced by other newer agents, such as Eliquis, but it is very, very popular, especially in third world countries, right? So you still have to understand that because a lot of people are still on Coumadin, right? Coumadin, which is generic name is Warfarin, is a powerful blood thinner, right? So that's used to prevent clots, that can decrease strokes, heart attacks, and clots to your lungs called pulmonary embolism, right? So it saves lives. Every day it saves lives. But it works by, and this is why I give this tidbit, so you can understand these things. It works by interfering with the body's vitamin K dependent clotting system. So we have a clotting system that depends on vitamin K, right? So we have to understand that's how Coumadin works. So we have to be careful, right? So we have to understand certain foods that are rich in vitamin K if you're taking Coumadin, right? Because that will interfere with the medication, right? So what are some of the side effects of Coumadin? Obviously, it's a blood thinner, so you're at risk of bleeding more, right? There is a value called the INR, right, which just looks at how thin your blood is, right? It can increase that value, right? And because of you're on Coumadin, and if you have a cut, if you fall and you cut your scalp, right? In a normal person, that might be buying a bleed, but on someone in fully anticoagulated on Coumadin, this could be a life-threatening bleed, okay? So when you want that medication, the things you have to look for are nosebleeds. And when you're on Coumadin, these things are hard to stop, especially if you don't have things, to deal with this stuff. Your gums start bleeding when you're brushing your teeth. You bruise easily, and then you start seeing blood in your urine or stool, right? Do not dismiss this as say, well, it's my Coumadin, because this other causes, right? We won't get into that, all right? And also a headache. You wanna be careful if you start getting severe headaches after you start Coumadin and you what we call therapeutic, right? Because you don't want to have a brain bleed. And again, this is not gloom and doom. This is educational, so we can be more aware. All right. Coumadin affects the skin. You will see you could have mild rashes. You could have discoloration, right? There is something called Coumadin skin necrosis where you have dark patches. So just things to know, in general. One of the things that they don't talk about is the thinning of your hair. I don't have that problem, but long-term users of Coumadin, you start losing your hair, all right? So again, these are just things to be aware of, especially the bleeding risk, all right? And Coumadin interacts with many medications. And your doctor, that's where the doctors come in. If you're putting your patient on Coumadin or your patient comes to you and they're on Coumadin, you have to talk to them about that. Because Coumadin interacts with certain antibiotics, antifungals, right? Certain seizure medications, even the pain medications, especially the NSAIDs, which are like ibuprofen, etc., that I have spoken about many times. But here's the kicker. Coumadin also interacts with some herbal products, okay? Ginkgo biloba, garlic, St. John's wort, right? They will make your blood even thinner. So you need to tell that to your doctor, all right? Especially if you're going to have surgery and things like that, all right? So Coumadin works by blocking vitamin K, right? And that's important, right? And vitamin K is used to make clotting factors in your liver, right? So if you increase your vitamin K intake, Coumadin becomes less effective, right? Your blood will not become as thin as it should be, right? So you have to be aware of that if you're on that medication. And again, these are generally leafy green vegetables, things that you need. So, but again, everything is a balance, right? So spinach, kale, collard greens, mustard greens, Swiss chard, bok choy, all these things are rich in, vitamin K, right? Your broccoli, your cabbage, asparagus, okay? And even green tea, all right? So just, I'm not saying to eliminate these foods at all. We just have to be consistent and knowledgeable of what's going on, all right? All right? Eat your vitamin, eat your vegetables, get your vitamins, right? And if you're on Coumadin, see your doctor, check your INR, your lab work and things like that, and just pay attention to the signs and symptoms that I talked about, right? So that's important to understand. Watch your alcohol intake, all right? Even your herbal products that I mentioned, just be cognizant of that, and things will be okay if you have that knowledge and you start seeing signs and symptoms. You see a doctor, things can be adjusted. So your clinician is a very important part of this, but you are the most important part of your health. All right. So this is what I wanted to bring to you, today, so you can understand. Coumadin is still a life-saving drug, right? But it requires discipline, monitoring, and awareness. That's not a medication you just put a patient on and just send them out there and take it daily. All right. We need balance. We need clinician involvement, but more importantly, this is to educate you on the dangers of Coumadin. Have a great day. Peace.